Welcome everybody and good afternoon. Today is an interesting session. It's called Learn, Embrace, Thrive with Metastatic Breast Cancer. And it is a program called UNPAUSE. And UNPAUSE means we do not stop. We continue to live. Pause means stop. In this case, unpause means we continue to live. And here today we have three very good examples of unpause. And we have two of them who are women living with metastatic breast cancer. And one of them, her husband, is with her. So we have Miss Chang Chu San, who is a MBC survivor. And we have Puan Rozi Maria as well, who has been living with MBC so far. And we have Chu San's husband, Mr. Quek, who has very agreed very much to be part of this session. And they're going to talk about living as MBC patient, and the caregiver also, who is Mr. Quek, is going to talk about how they've managed and are coping with metastatic breast cancer. And before I move on, I will just introduce myself first. My name is Ranjit Kaur, and I am the BCWA president. And I will talk a little bit about how important it is to talk to your healthcare team about yourselves. Whether you have early breast cancer or metastatic breast cancer, there will be many questions you have for your doctor, for your nurses, or even those people who are giving you support. So I will go through a few slides, which I will present to you. And then after that, I will ask Chu San, Mr. Quek, and also Puan Maria some questions about how they have been coping and managing themselves with metastatic breast cancer. Next slide, please. Okay, this is all about asking your healthcare team about yourself. Next slide. Now, there are touch points in our life when we have many questions on our mind. It could be when we are diagnosed with breast cancer or with metastatic breast cancer. Many more questions come to our mind about why we get metastatic breast cancer and how we can cope with it, about our treatment, and about living with metastatic breast cancer, as well as making decisions about metastatic breast cancer. I will be covering these topics during my presentation before we start the interview with Chu San, Mr. Quek, and Puan Maria. Next slide, please. So there are questions that people ask upon diagnosis of metastatic breast cancer. As I mentioned, it also applies to people who have early breast cancer. There are questions everybody has in their minds, and sometimes they are fearful to ask those questions. And it is always good to prepare the questions for the oncologist. And when we prepare the questions, we know that we will not forget to ask something. Sometimes we find ourselves walking into the oncologist clinic, and the moment we see the oncologist, we may forget a few questions. So it's always good to have questions written down, check with your family, discuss with your family before you can go in to see the oncologist and get all your questions answered during the consultation. So most metastatic breast cancer patients have this very important question: why did my cancer come back? Because she would believe that I had done everything to treat my breast cancer when I first had it, and now it has come back. Why has it come back? I was told that it is gone, and now why? So there's some form of disappointment. There's a feeling that I thought I had done everything, but why did it come back? So it's like, for some people, revisiting the initial diagnosis and results. It's like going back to your own memory of the first time when you were diagnosed before. It's all over again. And anyone who has had breast cancer can have a recurrence or a relapse of breast cancer at any time of their lives. It could be any number of years later. So we are always mindful, and we always tend to go for our checkups to make sure if anything happens, it is caught early. Now, what does it mean, metastatic breast cancer? And now, what is it called now? Is it still called breast cancer? Or is it called bone cancer if it has spread to the bones? Or is it called liver cancer when it is spread to the liver? So breast cancer, when it moves or it metastasizes to the bones, it's originally from the breast. And it is still called breast cancer, metastasized to the bones. It does not get called as bone cancer. It will be still breast cancer because the origin is breast cancer. And metastatic breast cancer will be different from other cancers. If it is spread to the liver, it will not be the same protocol as what you will have for another liver cancer case. All right. So the other one is, what now? What type of tests do I need? What kind of imaging procedures and scans and biopsies to confirm the diagnosis? Because initially it might be like one test that may indicate, or a symptom that might indicate. So following that, there needs to be more tests, more scans to be done, more running around to be done, more biopsies to be done to be able to confirm whether this really is metastatic breast cancer, or could it be totally different cancer, nothing to do with the breast. It could even be that. Next, please. Now, difference between breast cancer and metastatic breast cancer. So there is a difference in terms of what it is. Now, for metastatic breast cancer, we say that the cancer has spread to other organs, which could be the bones, it could be the lungs, it could be the liver or the brain. More commonly, it's the bones, lungs, and liver. But when it comes to treatment, breast cancer, when it is not metastasized, is generally treated for a limited period of time. After some time, the treatment is over. Whereas in metastatic breast cancer today, treatment is to basically slow or control the growth of the cancer. The treatment can be done continuously for a long time. And basically, it is to make sure that the cancer is always controlled and it's not growing any bigger, or it's not spreading any further. Now, there's different experience, different symptoms and side effects, different tests that need to be done for different people with different metastatic breast cancer. So it could be bones, and the tests may be different. The lungs and the liver may be different. So they all have different tests and scans and biopsies that may need to be done. Next slide, please. It's not an easy time when it comes to metastatic breast cancer. It can be very, very overwhelming. It can be very disappointing. It also is a fear as to how far the disease has spread, what can be done about it, can something be done about it? Now, how much and where has the tumor spread should be your question to ask the doctor. And I'm sure Chu San and Puan Maria had asked this question. There's also how fast the cancer is growing, which the test results can actually show as well. Will I get other symptoms? It could be like in bone cancer, this person might be having pain in the thigh or pain in the pelvis, and it's not going away. And will there be other symptoms that will come after that? What tests will she need right now, and how long will that take? You want to know what it entails, because it's something totally new compared to early breast cancer. What type of breast cancer do I have, particularly when it is already diagnosed? And so you have the 5 different types, which is, it could be hormone receptor positive or hormone receptor negative. It could be HER2 positive or HER2 negative. It could also be triple negative, which means it is the hormone receptor negative as well as HER2 negative. So you would want to know what these results are and what treatment, because the treatment will then be based on these results. And how will this affect my treatment? So these are the results that probably will be used for planning the treatment. And have you given treatment for this type of treatment? Have you given treatment for this type of MBC or this type of results? So you have other patients who may have gone through this disease, metastatic breast cancer, with probably the similar type of condition you are having, and you would want the oncologist to know, to tell you if that oncologist has actually treated somebody else before, and any other information that I need to know about this type of cancer. Do not be afraid to ask your oncologist questions. Do not be afraid. Do not be feeling humiliated that the oncologist thinks it is a silly question. All questions are valid, particularly when we ourselves are serious about our own condition and our own selves. Next slide, please. Now, preparing questions regarding treatment aspect. We've finished with the diagnosis, and now we go to treatment. Now, treatment is in metastatic breast cancer is also important to make sure that one is living with a good quality of life. Now, all treatments have got benefit and risks, and it has to be weighed. If it gives more benefit, that's what you want. And usually now, oncologists make informed and shared decision making, which means all information is given before decision is made jointly together by the patient, the oncologist, and if there is anyone else with the patient who is significantly involved. Now, what is the best treatment for my condition is your question that you would want answered. And is it a combination of different treatments or just a single treatment? And will there be any change of treatment over time? Many a time you find that in metastatic breast cancer, there can be changes of treatment because after a while, the cancer may not respond to the treatment, or rather the treatment fails, the medicine is failing the controlling of the cancer. So you also have to change the drug. Most importantly, in Malaysia, we find that cost is an important factor when it comes to treatment for metastatic breast cancer. So one has to think of where to get the funding from, where to get the money from. If you're covered by insurance, that is very good, but if you're not, then it is difficult. What are the main type of treatments? They are basically chemotherapy, hormonal therapy, targeted therapy. These are the main type of treatments, and you might want to know more details of the type of treatment that is going to be given to you, because there's so many types under chemotherapy, under hormonal, as well as targeted therapy. And is there a clinical trial for a new treatment that I can join? Now, this is an extremely important question, because if you are enrolled and your criteria fits into the clinical trial, you probably would benefit a great deal, because in clinical trials, they always have something that is either as good or might be even better than the previous drug. What type of side effects should I anticipate? So it's always good to know what to expect with the treatment, so that you yourself can be ready for it and be prepared, and also it will not be a surprise to you and to your family. Next slide, please. Now, list of questions again for treatment. What medicines will I be taking and how often? What is the duration, as well as what is the frequency of the treatment? How will the medicines be administered? Will it be by intravenous, or even in some, like, for example, certain trastuzumab is given as a subcutaneous injection, or it could be in the form of tablets. All these need to be known so that you know what to expect. And how long, how will we know if the treatment is working? What are the regular tests or scans that the oncologist is going to ask for to be able to monitor whether the treatment is really making a difference and also controlling the disease? Now, how will I benefit if I join a clinical trial? You could ask about it. If there is a clinical trial, you would want to know what benefit you will get, and any possible side effects of the treatment, food or drink before and after treatment to prevent side effects. So there are many ways to overcome this, and sometimes you get it also not just from your oncologist or the nurse. Sometimes other patients will also be able to help. And how can I manage hair loss? Where can I get help? So here I've got slides. On the slide, I've got a library of wigs, which Breast Cancer Welfare Association Malaysia offers for those who lose their hair. And we also offer free shaving as well as wig styling services, so that the wigs look so natural on the person's face that it doesn't look like a wig anymore. So if anybody needs that help, please contact BCWA for that. Now, next slide, please. Now, again, treatment for MBC or metastatic breast cancer is lifelong, and there's a possibility of change of treatment over time, as I had mentioned earlier. So most people with MBC continue to have treatment, and you need to always inform the oncologist of side effects and find ways to manage. And it is nowadays quite good to also explore complementary therapy. In Malaysia, we know that there is complementary therapy, or rather we call TCM, traditional and complementary medicine, which is existing in National Cancer Institute or Institute Cancer Negara, where the oncologists and the TCM doctors actually work hand in hand during treatment to help the patient to reduce the side effects of treatment as well. So that can be done to take advantage of it, and avoiding planning of any important activity for the first few days after the intravenous treatment, so that you don't get some adverse side effects and then you have to cancel your any of your important activities. So it's always better to observe what happens after your first few days of the intravenous treatment, to make sure that you are still energetic, you are still able to participate in some of the things that you had planned. So no important activity to be planned for the first few days, but after that should be okay. Next, please. And let's get on to about living with metastatic breast cancer. We finished with treatment. And how long can one live with metastatic breast cancer? And that is a million-dollar question, actually. And today, one can continue to live for years with MBC or metastatic breast cancer. Yeah. And continuous treatment can be given to control the growth of the cancer, to reduce symptoms. There are ways to reduce the symptoms and also to increase survival. And there are many, many innovative treatments that keep coming up for people to be able to take advantage of it to continue to live life. So many people are living for years and years after metastatic breast cancer all over the world now. And sooner or later, you're going to find that it is not going to be considered that this is the end, but you can still continue to live a normal life. And afterwards, when I interview two of our distinguished guests and also the husband of one of them, you will come to know a bit about how people are living with metastatic breast cancer and how they continue to live active lives as well. And management of signs and symptoms of side effects can also be very well organized now, and people have many methods of managing symptoms of side effects. And also quality of life can be improved during the treatment as well. And how to live with metastatic breast cancer, there is really a delicate balance between treatment, doctor's appointment, and daily routine. So you need to balance it, because you need to go for regular treatment, and the patient also needs to then in between be going for doctor's consultations, and then at the same time continue to live their daily routine and carry out their responsibilities in family as well as in society if they're working women. And managing fatigue, many a time you find people who have had treatment for a long period of time may be facing fatigue or exhausted or tired for longer periods of time. There are methods of managing that. There can be also a lot of complementary treatments for for these symptoms like managing fatigue, pain, and other side effects. After MBC is basically adjusting to a new normal, which our guest speakers are going to share with us what their new normal is compared to their old normal. Next slide, please. So support is important when living with metastatic breast cancer. Support from other people who have gone through or are going through a similar experience. So there could be support with other people who are MBC patients who are going through a similar experience, who can actually share their own experience, who can provide support, who can also show you the way and find resources and facilities that you can find to try and help yourself, and also provide you social support like friendship, like being there with you. And we have such a program at Breast Cancer Welfare Association, which is called Pink Inspirers. Pink Inspirers is an online metastatic breast cancer group where those who have been diagnosed with metastatic breast cancer give permission and request for being part of this WhatsApp group, and they get introduced to the group, and the group then provides support from them, find them logistics or any information that they need. And mind you, the group is so dynamic that they are always supporting one another and providing each other with information that is important for them. As we speak now, there are conversations going on in that group as well. And another support that a MBC patient can get is Through My Eyes. It is a book that tells stories of women who have had metastatic breast cancer in order to create awareness across Asia. You can go onto this www.thrive-Thailand, because Thailand has actually published it. But otherwise, if you just Google Through My Eyes, Asia Pacific, and this has been initiated by Pfizer in Asia Pacific region, you could probably even go through and see that. Next slide, please. So the different types of support that we need when we have a condition like this, most importantly, is the medical support, which we get from our oncologists and the nurses that are in charge in the hospital. But secondly, we need psychosocial support, that is psychological support and social support, and a possibility of getting linked to maybe, first of all, a psycho-oncologist or a counselor for your own self and for your family. The other one, of course, is to ask whether there are services covered. These services are covered by insurance, particularly the psycho-oncologist. And when you're referred to the psycho-oncologist in the hospital, this is found in most major hospitals, and you need to check whether your insurance can cover it. And others are like patient support groups, like I mentioned, the Pink Inspirers, which are right there as an online group, and peer support and peer navigation, which can be also sought from Pink Inspirers, and also connecting with other women who have metastatic breast cancer experience. And sometimes you connect because you are there in the hospital waiting to see your oncologist, and you meet other people who have got similar experience as you, and you form a friendship from there. And many people from Pink Inspirers actually are involved in such a way where they actually by chance met somebody who was waiting for the oncologist, and she was also waiting, and they started talking, and they realized that they're both in the same boat and they want to be friends. Next slide, please. Now, do not forget the physical part, besides the mind, which needs a lot of support. The physical part is to do with dietary and physical activity issues, food intake, to make sure that you still have energy, and also to have some physical activity, which keeps you healthy and also fit. And the other one, of course, is reducing the impact of fatigue. Most of the time it's physical, but sometimes you can also do a lot of mind control, relaxation exercises, meditation. All these can help you. And TCM, as I had mentioned, traditional and complementary medicine, in a hospital setting is more important. You have to see a licensed doctor, someone who has had a medical degree as well as training in TCM, not one of those in the shops in town. So it's not that. Traditional complementary medicine is something where the doctors are trained and they are working as a team with oncologists as well. And complementary therapies for individuals with MBC can actually help a great deal. Say, for example, music therapy, reflexology, acupuncture to reduce symptoms, massage, Tai Chi, yoga, meditation, art therapy. There's so many things that one can explore and do depending on what you find fits your interests. So this is what I would like to share with you with regards to how you can connect and ask questions from your oncologist and also from your other medical team members. Next slide. So thank you for listening. I would also like to share with you that this entire session, we've had many such symposia, and this is our second last symposium, which is being supported by Pfizer Malaysia. We're very thankful to Pfizer Malaysia for having invited us to let us do such a session, and for Pfizer Malaysia to support these sessions to educate us and also to provide support for us. So can I have, I can see Puan Rozi Maria. I also would like to have Chu San to come, Chu San and Mr. Quek to come up so that we can see both of you. Puan Maria, terima kasih sebab you dah sudi untuk ambil bahagian dalam sesi ini. Puan Maria, Puan Maria pernah buat temu duga terlebih dahulu kan, di mana Puan Maria telah berbincang mengenai keadaan Puan Maria, dan boleh tak Puan Maria bagi tahu sedikit pasal apakah jadi motivasi Puan Maria untuk terus hidup?
Okey, daripada mula-mula saya didiagnose dengan breast cancer, masa tu tahun 2018. Kemudian awal 2020 ni saya didiagnose dengan kanser kali kedua, yang mana kanser tu tumbuh semula dekat tulang sternum saya pula. So orang yang pertama saya akan tengok adalah anak saya yang paling kecil, yang bongsu, Zara Tihani. Saya memang setiap kali saya pandang dia, saya rasa macam oh tak boleh, macam mana pun saya kena berusaha untuk jalani rawatan. Saya mesti usaha untuk sihat sebab dia. Sebab dia, saya rasa dia kecil sangat lagi. Kalau saya nak tinggalkan dia tu macam tak ada orang boleh ganti tempat saya. That's why saya berusaha untuk sihat.
Berapa umur anak bongsu Puan Maria?
Sekarang ni dia dah 5 tahun. Masa saya didiagnose tu dia baru 3 tahun sahaja.
So masa tu dia sangat kecil. Ada tak dia faham ibu selalu perlu pergi ke hospital? Ada tak dia ikut Puan Maria pergi ke hospital dan sebagainya?
Sangat surprisingly sebab dia cuma 3 tahun. Tapi bila, sebab saya seorang yang berterus terang dengan keluarga, dengan suami, dengan semua anak-anak yang lain, saya beritahu keadaan diri saya. Yang saya sakit, saya perlu jalani rawatan di hospital. Jadi walaupun dia cuma 3 tahun, awalnya dia tak faham. Dia cuma tahu sakit. Tapi dia tak tahu saya ni sakit apa. Tapi dia belajar dengan cepat. Dia jadi budak yang sangat matang. Jadi dia faham. Masa saya berada di hospital, kanak-kanak bawah umur 12 tak boleh melawat kan. Jadi setiap malam saya akan buat video call dengan dia. My husband akan buat video call sebelum dia tidur, beritahu keadaan saya apa semua, and then dia okay. Lepas tu dia jadi kanak-kanak yang grow sangat cepat. Dan sekarang ni dah dia 5 tahun. Tempoh hari masa PKP saya lalui jalan kemo, second line kemo. Jadi bila selepas kemo tu keadaan kita lemah, kita letih, dia datang, dia akan massage kaki, massage tangan saya. setiap kali kalau saya perlu bantuan nak minum, nak makan ke, dia akan tolong ambil. Dia bagi tahu dekat ayah dia bagi tahu dekat kakak dia, mama nak minum. Jadi dia tolong ambil. Memang dia faham lah, bila saya tidur dia tak akan ganggu. Bila saya bangun baru dia nak minta apa-apa, dia akan minta bila saya bangun daripada tidur.
Saya rasa sangat terharu apabila saya dengar budak yang sangat kecil macam itu boleh bantu ibunya dan juga boleh apa tu, rasa macam dia tak ganggu apa-apa, dia tak jadi nakal, ya.
Yes, dia sangat-sangat memahami.
So adakah Puan Maria rasa Puan Maria pun sangat bernasib baik ada anak macam tu?
Ya, sebab tak sangka lah, sebab dia masih kecil dan dia boleh membantu dan dia cuba memahami. Bila kita dalam sebab kanak-kanak kecil ni selalunya dia minta mak dokong, peluk dia. Saya tak boleh dokong dia dah. Sebab yalah dia dah berat, tangan saya pun dah tak kuat kan. So saya tak boleh pegang, tak boleh dokong dia. Kadang-kadang ada masa dia peluk saya, agaknya dia terlalu kuat. So saya akan cakap, sakit, jangan peluk kuat-kuat. So macam dia, sakit ni mama, sorry. So dia okay, dia lepaskan sikit lah pelukan dia tu. Tapi rasa kesian tapi terharu juga sebab dia boleh faham keadaan kita. Macam tu lah.
Ya. So sekarang Puan Maria pergi untuk rawatan berapa kali? Macam kerap kali berapa sebulan sekali ke macam tu?
Sebab hormon reseptor saya HER2 positif, saya kena ambil ubat Herceptin target terapi. Dan oleh sebab kanser saya yang kali kedua ni, doktor maklumkan tumor tu respond well dengan ubat Herceptin. Jadi ubat Herceptin tu saya kena ambil seumur hidup saya setiap 3 minggu sekali. Jadi setiap 3 minggu saya kena ke hospital untuk masuk ubat Herceptin tu. Ubat Herceptin tu dia macam ubat kemo lah, masuk through drip. Lepas tu saya ada rawatan fisioterapi lagi. Fisioterapi setiap 2 minggu sekali. Saya ada juga rawatan susulan dengan doktor SOPD, jumpa dia setiap 3 bulan macam tu. Saya ada kemarin masa hari Rabu saya baru buat CT scan. Bulan 1 nanti saya ada bone scan pula. Banyaklah appointment saya.
So ada tak macam Puan Maria rasa penat pergi sini, pergi sana, pergi klinik ini, klinik itu?
Macam mana nak cakap, penat tapi saya dah boleh adapt keadaan tu. Jadi saya tahu saya dah ada dalam handphone saya memang memainkan peranan penting. So dekat kalender saya memang ada schedule, saya punya appointment, semua appointment ada dalam handphone. Jadi memang saya sentiasa alert appointment saya bila apa semua. Dan saya dah anggap hospital tu rumah kedua, so tak ada masalah. Saya pergi buat Herceptin pun saya pergi drive sendiri pun. Bukannya husband saya hantar apa semua sebab dah biasa kan. So okey je.
Okey, nanti saya akan tanya Puan Maria lebih banyak soalan. Tapi sekarang terus tengok macam mana Cik Chu San dah balik ke tak. Chu San, are you there? Can we see you? Puan Maria jangan apa tu tinggalkan dia. Saya nak tengok. Okay.
Hi.
Yes.
Hello, Ranjit.
Yes. You're much clearer now.
Can you hear?
Yes, we can hear you now much better.
Okay.
A little bit about your initial time when you were first diagnosed with metastatic breast cancer. I remember you said just now it was spread to the liver and you did have some symptoms which got you to go and see the doctor. Can you tell a little bit about that?
All right. Actually, for liver, because according to the doctor, when it spread to the liver, it's sort of like quite a late stage. Actually, when you have the symptom, when you feel the symptom, I just feel discomfort. Actually, my routine is still the same. I'm teaching as usual, but then I just have a little bit of discomfort in my stomach and gastric feel like that. So I just went for an ultrasound. I never expect the cancer came back so fast after 6 years, actually, after my first cancer. So after the ultrasound, looks suspicious, a lot of dark spot at the liver there. So I have to further on go for CT scan, and I even went for colon scan, stomach scan, all the scan I did. And the doctor said that my liver was full of tumor. It's actually 60% of my liver is with tumor, and the biggest tumor is about 14 cm. I got a shock after that because it's just like a little bit of gastric pain. So I went for further biopsies, and it's confirmed that it's a liver tumor. So at first we were thinking it's like a liver cancer, primary, like just now what you said. And further test, the doctor advised me to do another HER2 test because I was HER2 positive. So I had to go through all the tests again, and it's confirmed it's metastasis from the breast cancer. So it's called breast cancer actually, because we were a bit worried if it's a primary liver cancer, it's harder to treat. So I follow what the doctor advised to treat, like what I did during the chemo, using the breast cancer drugs, Herceptin and so on.
Thank you. I would like to go back to your previous, what you said just now. You said, you mentioned that, the gastric, it was a bit like a gastric pain. And it was like something not so major.
Yes.
Who did you see first? Did you see a GP or just an MO, or did you go straight to your oncologist or your breast surgeon? Whom did you see first?
Well, I just went to see I actually went to see the internal medicine actually. I was thinking of a stomach scan. So I thought it's a gastric actually, because I used to have gastric pain when I was young. So I was thinking at that time, because I was very busy with the schoolwork, and then I also have irregular meals at that time. So I just suspect that it's just a gastric. So I actually first is to do a stomach scan. Then the doctor, it's just an internal medicine doctor. So I didn't go back to my oncologist because it's never come into my mind. I live a very healthy lifestyle after my breast cancer actually. So it still come back,
Yeah. So this is something that we learned, that our life can be as healthy as possible, but we never know that MBC can come back at any time to anyone in our lives. Mr. Quek, I want you to have your face closer to Chu San. Chu San, don't move away. Chu San, don't move away. Yes, Mr. Quek, come closer to Chu San.
Okay, sure.
Head closer to. I can see both of you now. Now it's nice, Mr. Quek. I know you for quite a number of years.
Yeah.
Of course, through Chu San, you have been a pillar of support. But my question to you is, before you gather the strength to support her, it must have been difficult initially for you to hear that your wife, of course, you had already been through before the fact that your wife had breast cancer, early breast cancer long ago. And then after early breast cancer, you went through with her all the challenges. And then now, 6 years ago, she had this metastasis to the liver. How did it affect you in the beginning when you heard it, just yourself? I'm not talking about your support for your wife, but you yourself, how did it affect you?
It's quite surprising now, because after the first, she went to the healthy life, exercises, everything, but suddenly recurrence, a relapse. So it's quite a bad news to me lah. So, but what can we do? We have to take it, because for me, is we get a good treatment for her, because nowadays with the new technologies and the advanced technology that can be cured. So we Google, then look for the best oncologist specialist on the liver.
Mm-hmm.
So we never lost hope lah. We try our best, okay, and do the prayers, okay. Then like normal lah, because before that 6 years ago, the same thing we have to go through, okay, shine or rain, we have to go forward. That's
right.
how. Yeah.
I do believe that what the word you use, hope, same thing for Maria was harapan. You know, you have the hope, you want to get better, and you want to continue to live life. Pada mula-mula Puan Maria mungkin rasa macam tak ada harapan ya bila diberitahu telah ada apa tu sternum telah kena ya, ada metastasis kepada bones ya, kepada tulang. Tapi lepas tu bila doktor beritahu, so the main thing here for both of you is doktor telah beritahu ada ubat. Bagaimana you rasa pada masa tu bila doktor kata ada ubat? Sebab you dari luar dah dengar orang lain MBC, oh my god, tidak boleh dirawat. Okay, metastatic breast cancer cannot be cured. But you hear from the doctor, what was it that make you feel that when the doctor said ada ubat? Because both of you are HER2 positive, both Maria and Susan, both of you are HER2 positive.
Yeah.
Apakah bila doktor kata ada ubat?
Yeah, for me, actually, I just share lah. Actually, I went round shop for three hospital, 3 doctors, 3 oncologists. So the first experience was actually quite bad. No ubat, not what you say got ubat. I experienced the onco told me, go back, pray, you know, no treatment lah, you know. So I was very down and very sad, but I never give up. So I went to another doctor, and this doctor gave me a very promising answer. Yeah, you can go for chemo, even though your tumor is multiple, it's everywhere. Just like what Miss Ranjit had said just now, I asked question, have you treated this type of cancer before, and what's the chances, you know, all kind of question I asked, and he gave me a very, very positive and very promising answer. So I was very confident then, and I was very lucky I chose him as my onco, and I live until now after 6 years. So I think I should go back and see the first onco and say I'm still living, surviving now, and surviving very well.
We can arrange coffee with your first onco to tell him that you are.
Yeah, actually, it's very you know, sick and very disappointed when we heard that if you have metastasis, then you are in the 4th stage. There's no treatment for you, no drugs for you. At 6 years ago, yeah.
2 doctors, not 1.
Yeah.
Both oncologists. Yeah.
2 doctors gave you no hope.
Yeah.
And 1 doctor gave you the hope. So you moved from no hope to hope.
Yeah. So actually the right choice, we made the right choice, but of course the cost is so much different, because when we went for consultation, of course it's the cost that also worried us a lot. It's not cheap to do all this targeted therapy.
Yeah.
We have to make a choice lah. So instead of life and money, I say I want life. So money we still can earn back. So I'm glad that I go back to work. I go back and earn money some more. You can go and earn some more money to continue my treatment.
I will come back to you in a while.
Alright.
Puan Maria boleh tak beritahu, daripada tak ada harapan, you lepas tu diberi harapan oleh onkologis. Macam mana Puan Maria rasa pada masa tu?
Okay, ambil. Sibuk Cik Zara saya. Sebenarnya masa saya jumpa dengan Dr. Onko tu, diorang tak beritahu saya yang tak ada harapan. Sebab saya didiagnose kali kedua ni baru lagi awal tahun 2020 hari tu, masa bulan 1. Jadi doktor kata sekarang ni ada banyak rawatan, banyak ubat-ubatan doktor bagi tahu saya. Tapi masa saya dapat tahu saya didiagnose yang kanser saya tumbuh semula tu, memang sangat-sangat kecewa. Memang rasa frust, memang rasa sedih sebab rasa dah jaga betul-betul ni. Dah buat pembedahan, dah buat kemo, dah buat radioterapi. Tapi kanser saya tumbuh
dah kata clear. Doktor dah kata clear kan?
Doktor kata kanser awak terkawal, dah clear masa dalam tempoh setahun lebih lah masa tu. Tiba-tiba belum 2 tahun kanser tu dah tumbuh balik semula. And then doktor bagi tahu saya selepas dah buat CT scan apa semua, doktor beritahu saya kena buat balik semula kemo, second line kemo. Kali ni dengan ubat paclitaxel yang side effect dia lebih sakit daripada docetaxel yang sebelum ni. Masa tu saya dengar kena buat kemo lagi 6 cycle, memang rasa macam kenapa benda yang sakit tu saya kena ulang. Tapi walaupun kena ulang semula, 6 kali cycle kemo tu, saya rasa kemo kali kedua ni saya dapat well manage lagi baik. Kalau sebelum ni saya selepas kemo hampir 6 bulan jugalah saya jalan perlahan, sakit dekat joint pain semua. Tapi yang kali ni baru lepas 2 bulan saya dah boleh jalan 5 km, 6 km. Dan pagi tadi pun saya buat brisk walk dengan my husband. Dia cakap dengan saya dalam 5 ke 6 km je nak jalan daripada Taman Tasik Titi Wangsa sampai ke Pintasan Saloma. Last bila tengok balik set masa apa semua 8 km saya jalan. Saya nak marah dia, saya cakap kenapa awak game saya kata 5 km je, ni 8 km, kaki saya dah kempal. Tapi saya dapat well manage lah. Kalau tak dulu memang dalam tempoh 3 bulan selepas kemo tu saya tak boleh nak jalan laju. Memang saya tak boleh lari, saya memang kena jalan perlahan je sebab sakit kan. Joint pain pada betis semua, otot semua. Tapi kali ni dah well manage lagi. So
Bagus.
walaupun masa dapat tahu kanser tu relapse semula tu sedih dan doktor kata rawatan tu ada. Cuma awak tak boleh dapat sembuh 100%. So doktor kata kanser yang ada ni kita boleh kawal. Jadi you kena ikutlah apa plan rawatan yang doktor cadangkan tu. So memang saya dah selesaikan kemo. Then sekarang ni continue dengan Herceptin. Follow up je lah, ikutlah saranan tu. So far alhamdulillah much better lah.
Okay, saya akan tanya Chu San soalan sekarang. Chu San, you are a mathematics teacher.
Yeah.
We've always been very surprised by you being a mathematics teacher, you know. And the other thing about you is that your husband has always been there to support you. Both of you are like twins. We always see you exercise together, do things together, go out together. Can both of you tell me what motivation do you get from doing all the activities you're doing now? And I want you to share what activities do you do now? Since the time that you have always been active physically, but since your metastatic breast cancer, what have you been active with? And I want both of you to be close to each other so we can see both of you. Yes, that's right. Yes.
Yeah, actually, I'm very active person, outdoor. I love nature, I like outdoor, and we've been doing a lot of hiking. So after my MBC, even after my targeted therapy, after in the morning I had my treatment, afternoon I go hiking already, and I always pull Quek along. Last time he was not so outdoor. Now he has to follow me. Yeah, and then he's getting healthier now also. And then I love nature. I love waterfall. I love to go jungle trekking. So he is the one who is always together with me to do all these things. Even now I do dancing, Zumba. He got time. He will also just shake beside me. Yeah. So these are the things that we normally do. So for us, I think I don't treat myself as a cancer patient. I also tell him, don't treat me as a cancer patient, just like normal. We just continue our normal routine work. And then we go out together, we travel together more often now. We treasure more of each other now more and spend more time together. So both of us motivate each other actually. Yeah.
So Mr. Quek, I would like to ask you a question.
Sure.
Were you healthier before or are you healthier now?
Now, because before she got the cancer, I just concentrate on my work. I mean, she worked on her, so the time together is less. But now, I try to do my best to give the best to her, so that in future there is no regret. If anything happened to her, I feel that I've done my best. That's all. The fate is on God's.
So what would be your message to other men with regards to their relationship with their wife in terms of spending time together and value the time?
So, I mean, for those who, although the spouse healthy, we must spend more time each other, because life is short. We can't predict what is going to happen. Near future or further future. So don't wait until something happen, then you just some like my colleagues have no time together because it's happened very fast. Between a few weeks, the spouse passed away. So my word to the others, although your spouse is healthy or not, you have to spend more time together and support each other so that you can build out the relationship and with the family, bonding with the family. So at least you can have a better quality of life.
So really not to take life for granted, isn't it?
Because we can't predict. Life is short, frankly speaking.
Yeah.
So
Puan Maria had told me one thing just now. How her little daughter supported her. Chu San, can you tell us a little bit about your children when you were first diagnosed, and how did your children support you? What their age was?
All right. My first primary cancer, they were in primary school. And of course, at that time, they don't really know, but when they heard the word cancer, the first thing my elder son asked me, Mommy, how long are you going to live? Are you going to die soon? And then, are you going to feel very sick? Are you going to lie down bedridden and so on? He will ask this type of question, even though he's just one at that time. And then when the cancer came back, MBC at that time, they were 6 years ago, they were already secondary school students, and they understand better. And I told them, I promised them, I said, Mommy will be stronger as before, because they have seen me after 6 years, I become stronger, more active, live life as normal. So I also told them, convinced them that I will be fighting. I will never give up. And I told them I will want them to see them success in their life, to graduate, and I have done. And they have done that, and I also have seen them go through all this. So actually, my children, once I show to them that I'm living as normal as I mean, they feel like they are quite secure, they are quite happy, Their mommy is still as strong as before. So for them, they are not so worried actually.
Family support, children support is very important.
Yes, yes, correct.
I think one more thing I want to ask Puan Maria. Puan Maria, bagaimana kawan-kawan Puan Maria sekarang melihat Puan Maria? Macam mana diorang communicate dengan Puan Maria? Adakah mereka rasa Puan Maria adalah seorang pesakit, ataupun diorang rasa macam you dah jadi inspirasi untuk mereka?
Saya seorang kaki tangan kerajaan, bekerja di pejabat, jadi memang ada ramai kawan-kawan pejabat lah. Sepanjang tempoh saya mula-mula sakit, memang saya mengambil cuti sakit barah selama 2 tahun. Tapi walaupun saya cuti, saya ada juga datang ke pejabat sebab saya kena hantar sijil cuti sakit saya, MC saya. Surprisingly, yang bila saya jumpa kawan-kawan pejabat yang lain yang macam bukan daripada unit saya lah, daripada bahagian pentadbiran, bahagian kewangan, bila dia orang jumpa saya, masing-masing cakap, nampak sihat lah, nampak macam bukan orang sakit, betul ke? Ada kanser kata berulang balik semula, dah stage 4, betul ke? Saya cakap, betul, saya pesakit kanser. Memang kanser saya stage 4. Tapi sebab diorang kata tak nampak macam orang sakit, so saya okey je lah. Diorang pun macam treat saya macam biasa. Okey, ajak pergi makan. Diorang pun macam, kalau kawan yang klik yang satu pejabat dengan saya, diorang tanya juga, boleh makan ke? Kalau nak makan daging ke apa ke, tak apa ke? Saya cakap, tak ada apa, tak ada masalah apa-apa. So diorang pun, bila diorang tengok saya physically nampak okey, nampak macam orang sihat macam biasa, diorang pun tak rasa yang takut lah nak kawan dengan saya atau nak terima saya. So far semua bosses pun jumpa saya pun semua cakap, you nampak bagus, you nampak okey. So bila okey tu okey lah maknanya, tak ada masalah.
So ini jadi satu pengalaman untuk kita di mana kita jadi seorang yang mengajar orang lain kan, kita membawa pengajaran untuk orang lain yang tak tahu pasal penyakit begini. Jika seseorang itu ada metastatic, kanser payudara metastatic, dia bukan macam seorang pesakit yang selalu baring saja macam tu kan. Adakah itu anggapan mereka?
Awalnya diorang memang rasa macam tu. Sebab diorang ingat bila dah metastatic breast cancer ni, diorang ingatkan bila dah saya buat kemo lagi sekali, diorang rasa macam mungkin saya ni tak boleh bangun. Diorang fikir macam tu. Mungkin kalau physically muka mungkin nampak macam muka saya ni pucat, nampak pale apa semua. Tapi bila saya keluar, bila diorang tengok saya jalan macam biasa, dress up macam biasa, make up macam biasa. So diorang rasa macam betul ke? Diorang tanya balik. So saya rasa macam bila kita sakit, kalau kita layan sakit tu, kita nampak macam orang sakit, memang kita akan jadi lebih sakit. Tapi kalau kita ambil yang positif, kita sakit, kita jalani rawatan, ikut nasihat doktor, and then jaga makan bukan maksud saya tak makan itu, tak makan ni, tak. Kita makan, jangan terlalu diet yang ekstrim sampai tak makan, sampai jadi lemah, tak. Kita makan macam biasa, follow yang KKM punya rules, suku-suku separuh, jaga pemakan supaya kita sihat. Sebab supaya sihat tu penting. Bila kita nampak macam sebenarnya tak adalah, bila kanser tak adalah macam teruk sangat yang melepek, yang itu pada saya mungkin dah advanced stage yang memang dah tak boleh bangun, yes, itu baru kata kanser yang advanced stage. Tapi kalau walaupun kanser saya doktor kata stage 4, tapi still boleh dikawal. Jadi saya rasa tak perlulah nampak macam orang sakit, macam yang terlantar, bedridden macam tu. So nampak macam biasa is okay. Yang penting kena tengok benda dari segi positif.
Ya. Yang saya nampak di sini, walaupun jika ada doktor ke jururawat ke siapa-siapa yang membawa kesedaran kepada orang ramai mengenai metastatic breast cancer ataupun kanser payudara metastatic, jika dibandingkan dengan seorang macam Puan Maria ataupun Puan Chu San, kalau datang daripada you orang, bila you bagi kesedaran kepada orang lain, sebagai seorang yang memang saya pernah dapat MBC dan saya masih lagi hidup, saya menjalani rawatan, saya makan macam biasa, aktiviti fizikal saya lebih baik daripada orang lain kan. You orang aktiviti fizikal you lebih daripada orang lain yang duduk menonton TV saja ataupun duduk di depan komputer untuk sehari. So pada hari cuti you adalah di luar sana buat exercise, tapi pada hari cuti orang lain duduk goyang kaki saja. So I think this is a very good education di mana mereka lihat dan jadi saksi kepada orang yang ada metastatic breast cancer tetapi masih lagi hidup secara normal. Lebih daripada normal. So you adalah contoh-contoh yang sangat bagus. You are the heroes who actually can educate the public very well. So we have some messages here. Well done, Puan Maria and Chu San. Be strong and thank you for sharing your experience. Not only be strong, they are giving strength to everybody else. Family bonding is important in keeping us motivated to live and fight cancer. Friends and relatives are more supportive and caring. May God bless all of us. So setuju dengan pendapat Maria. Ada juga SS bagi tahu. Ini adalah daripada chat box kalau you boleh buka ya. Thanks Madam Chu San. So you have a lot of very good messages. I see Chu San has also answered some of the replied to some of them. There is a question to Puan Maria. Puan Maria, pada tahun 2018 masa first diagnosed dengan breast cancer, masa itu tahap berapa dan besar mana tumornya? So saya tidak mahu Puan Maria jawab soalan ini sebab saya nak beri maklumat kepada semua yang menonton bahawa you boleh dapat breast cancer stage 1 tapi beberapa tahun depan boleh juga dapat MBC ya. You boleh jadi stage 3 tapi tak dapat MBC. So it is very very different. We don't know who can get MBC, who cannot get MBC. Just like many people diagnose early stage tetapi boleh dapat MBC juga, ya. So we don't know what's going to happen. Only thing is doctor says kita pergi untuk pengesanan awal, dapat rawatan pada peringkat awal, kita punya chance untuk dapat MBC dikurangkan, tapi tidak tahu siapa yang boleh dapat MBC. Ada juga lepas 20 tahun, lepas 25 tahun pun ada orang dapat MBC, ya. So I have a question for Chu San. Chu San, did you ever go for clinical trial?
Yeah, during my first primary cancer, I went for a clinical trial. So it's for 1 year. Side effect was actually very bad. Yeah, but for this second one, MBC, I'm quite lucky to have this compassionate package for my targeted therapy. So I'm still doing the therapy every month. Until now, this is, I think, according to my uncle, I'm one of the record holder for this drug, Caregiver, because it's already 6 years down the road and it's my 74 times last week. Yeah, 74 cycles.
Very well done, and I think the company should now give you the drug for free. They have made enough money out of you.
Hello. Yeah.
Yeah. Yes, and so we have more good messages for both of you, which you can read from the chat box. So before I conclude, I would like you to say something. Puan Maria, sebelum kita there are some questions. Did you experience, Puan Maria, did you experience any symptom before you were diagnosed with MBC? Ada tak simptom-simptom sebelum you pergi dan dapat tahu bahawa kanser itu ada di sternum?
Tak ada apa-apa sakit. Cuma saya perasan ada kelainan dekat tulang sternum tu sebab ada something yang macam terbonjol keluar. Macam ada tulang yang tumbuh keluar. Tapi dia tak sakit. Bila saya tekan-tekan pun dia tak rasa apa-apa. And then masa first time saya perasan tu, saya beritahu dengan doktor semasa saya punya follow up sesi. Saya maklumkan pada doktor, doktor check-check dia kata ini tulang. Tapi saya cakap dengan doktor, kalau tulang kenapa before ni tak ada? Jadi doktor kata tak apa, kita follow up lagi sebulan tengok balik semula. 1 month after that, baru saya dah perasan bila saya cuba brisk walk, cuba jogging perlahan-lahan, saya perasan bila saya bernafas saya rasa dada saya sakit. Daripada situ saya bagi tahu doktor, tak boleh doktor, yang ini sebab saya dah rasa sakit dada dan tulang tu saya rasa makin keluar. So masa tu baru doktor hantar saya untuk buat ultrasound. Masa buat ultrasound tu doktor terus buat biopsi dan sampel biopsi tu positif kanser. Jadi kiranya kanser yang kali kedua METS ni saya kesan awal jugalah.
Okay.
So tulang tu yang tumbuh pun kecil, baru 1 cm lebih.
Okay, and I think there's a question here. Chu San, is there any difference in your way of life after your first diagnosis and second diagnosis? I can answer for Chu San because after her second diagnosis, she is more active than after her.
Yeah, I love hiking.
Climb even more mountains after.
Yeah, hiking a lot of mountains, conquering a lot of mountains. I can even hike 9 hours, 12 hours in the jungle. Yeah, I enjoy the nature. Actually.
Continuous.
4 years continuous also can.
And also tadi ada dengar apa yang Puan Maria kata, berjalan 8 kilometer ya?
Ya, tadi sama lah. Actually saya before saya sakit, saya cycling dengan my husband. And then bila sakit, bila buat rawatan terpaksa slow down lah kan. And then bila saya lepas kemo yang sebelum ni pun saya buat hiking apa semua. Tapi selepas kali ni sebab saya baru habis kemo awal bulan 8 hari tu. So kaki still tak berapa kuat, sebab tu saya kena training brisk walk lagi, training brisk walk. Saya sebenarnya plan untuk hiking balik semula, tapi sebab jalan 8 km tadi pun kaki saya dah kebas. So tak boleh lagi, kena berlatih lagi.
Okay, thank you very much for taking part in this interview. This was very, very useful for all the other survivors and people who are listening as well and who are watching. And we actually would like to say that this recording would actually be edited, and then we will put it on YouTube for other people to listen as well and to watch. There are lots of encouraging messages that you can see in the chat box. That are we would say congratulations to both of you, and also thank you to both of you for being our heroes. Sebagai satu conclusion, Puan Maria nak kata apa-apa kepada semua yang pendengar di sini?
Okay. Kebanyakan kalau saya jumpa kawan-kawan pejabat, family member saya, kebanyakan wanita kat luar ramai yang sebenarnya takut nak pergi check. Takut kalau ada apa-apa kelainan pada payudara, tapi takut nak pergi klinik, takut nak jumpa doktor. So pada saya, kalau perasan sebarang kelainan pada breast, pergilah check. Sebab macam saya ketika didiagnose dengan kanser payudara, saya dalam keadaan yang sangat sihat. Semasa saya buat pembedahan apa semua, awalnya doktor perasan ketulan tu kecil saja. Tapi tiba-tiba bila dah buat pembedahan, ketulan tu dah besar. Dikesan awal, tapi sebab kanser saya agresif, jadi ketulan tu dah besar. Jadi mana-mana wanita pada saya, kalau dapat kesan kanser tu dengan awal, so rawatan dia lebih mudah. Mungkin tak perlu kemoterapi, kalau stage 1 buat radioterapi sahaja. So jangan takut, sebab bila takut kita akan melengahkan rawatan kita. Bila kanser tu dah jadi worse, peluang untuk dirawat tu lagi susah. Pada saya, mana-mana pergilah cek. Kalau rasa kelainan pada tubuh badan, pergilah cek, pergilah klinik, pergi hospital. Dan pandang dari segi sudut yang positif. Apa-apa yang jadi dalam life kita ni, kalau kita pandang yang negatif, kita akan jadi orang yang negatif. Tapi kalau kita lihat sudut yang positif, insya-Allah everything akan jadi benda yang mudah kita lalui. Saya suka pepatah English kata apa? If someone give you lemon, then make lemonade. Betul tak? So macam itulah. Apa pun yang jadi, walaupun pahit, walaupun tak seronok, tapi kita jangan tengok yang bahagian yang pahit, bahagian yang tak seronok tu kita jangan fikir sangat. Kita cuba tengok mana part yang positif. Macam saya bila sakit ni, saya fikir sakit, okey, Tuhan bagi saya rehat daripada bekerja. Kalau tak, dulu saya rushing pukul 5:30 pagi, pukul 6 dah keluar daripada rumah. So petang saya nak pick up anak-anak lah apa semua. So by 2 tahun saya kena kanser ni, saya banyak rehat. So saya ada masa banyak me time. Saya ada masa nak pergi brisk walk dengan my husband. Saya ada masa nak tengok anak saya lebih. Compare kalau dulu saya asyik rushing pergi office, balik office, pergi office, kerja deadline, whatever apa semua. So 2 tahun ni saya banyak rehat sedikit lah. Jadi pada saya, pandang yang positif. Apa yang berlaku pun, yang negatif kita letak tepi dulu, kita tengok yang positif dulu. Macam itulah.
Apakah Puan Maria punya message untuk mereka yang ada kanser payudara metastatik?
Kalau kanser ni, apa-apa pun orang cakap, jangan stres. Jadi jangan sedih-sedih. Walaupun ada kanser tu masih boleh dikawal. Jadi bila boleh dikawal ni, kita cuba usaha sebaik yang mungkin jalani rawatan untuk kawal kanser tersebut. Mati atau hidup itu adalah kerja Tuhan. So orang yang tak ada kanser pun boleh mati. Tak semestinya orang yang ada kanser stage 4 ni esok lusa dia mati. So benda tu adalah urusan Tuhan. Kita tak boleh tentukan. Yang penting kita usaha untuk berubat, untuk menjaga kanser kita.
Yeah, I think that is a very good message, Puan Maria. Ada metastatic breast cancer ataupun kanser payudara metastatik, masih lagi kita boleh dapatkan rawatan untuk kawal penyakit ni dan terus hidup seperti mana yang Puan Maria dan juga Madam Chu San sedang hidup. Chu San, what both of you, Mr. Quek and Chu San, Mr. Quek, can you be the first one to tell us a few words before we conclude? And Chu San, can you come into the camera? Yes, that's right.
Okay, for the spouses, please, never give hopes. Now with the new technology and the advanced medical, the hopes is still there. So never give up and spend more and quality time with your spouse. Okay, so everything possible. There is nothing impossible. Okay.
Thank you. And
All
Chusan,
right. Okay, for me, don't isolate
can I have
yourself.
both of you nearer? Yes.
Okay, for me is don't isolate yourself. Try to connect with people and the support group, and you don't underestimate your own abilities. You know, even MBC, you can live a very meaningful life and live life to the fullest. You know, enjoy it. Appreciate every moment of your life. For me, even a very little things can make me very happy, and I fill my life with my hobbies. And now I have more times for the things that I want to do. So don't underestimate your own abilities. Don't lose hope and keep fighting.
I think all three of you are inspiration for everyone. Puan Maria, semua ketiga-tiga Mr. Quek, Puan Chu San dan juga Puan Maria adalah inspirasi bagi semua orang maupun kami ada breast cancer atau tidak, ya, untuk terus hidup, untuk terus berjuang. That is the most important thing. Dan jangan fikir doktor itu tidak ada bersama-sama kita, because doktor kita memang pakar-pakar kita memang membantu kita dan juga menyokong kita dan pastikan kita dapat rawatan yang bagus sekali, ya. So it is very important that we continue to control this disease as much as possible. And Chu San, would you like to say a little bit about Pink Inspirers, because you are one of the founding members of Pink Inspirers?
Oh yeah, Pink Inspirers actually consists of all the MBC breast cancer patients, and then we actually inspired among ourselves and also inspired others. It's actually a very meaningful chat group, the Pink Inspirers, and we discuss everything, even from doctors, from food, you know, lifestyle, treatments, and also about costing. A lot of things we discuss in the chat group, and we have. I'm quite surprising. A lot of the MBC patients, they are maybe their information are better than the doctors. Some of them, I think, they have a lot of information, especially about the drugs, the treatments, what they have gone through. You know, the side effects, how to manage it. Yeah, it's a very good chat group, and I would like to thank Miss Ranjit. She is the one who started. Yeah, I think you are the one who started this group, you know, to have the idea to create this group for all the MBC. And I have gained a lot of information and knowledge. And even though we don't meet with each other, but sometimes whatever that I read in the group, I feel that I'm lucky lah, actually, because I still have drugs to treat me. You know, I still be able to go on for the treatments. You know, because some of them, they have side effect that is worse than me, you know, but they are still keep fighting, and we motivate each other and give a lot of encouraging words among ourselves. So this Pink Inspirer is a very good and meaningful chat group. Yeah, it really motivates us, you know, to keep fighting.
Thank you very much to all our three speakers for this very meaningful session. And we will be seeing all of you next Saturday again. This is what we call the UNPAUSE session, which is supported by Pfizer Malaysia. We'd like to thank Pfizer Malaysia for this. Next week, which is on the 12th of December, at same time, we are going to have a session with Professor Dr. Muhammad Nahar. He is a sports physician. We want you to come to wear your sports clothes. You can wear your track pants or your shorts and get ready, because we're going to do exercise. He's going to teach us some exercise online. And we also will have a dietitian to talk about food. So please join us next week, all of you. And we'd like to thank you all once again, to the speakers and to the audience. Thank you, everybody.
Thank
Bye.
you.
Thank you.
Thanks, Ranjit.
Bye.
Bye.
Thanks, Ranjit.
Bye. Thanks.
Bye,
All
everyone.
stay safe and healthy.
Bye, thank you.
Bye, everyone.
Thank you.